Rick comes to work and gets started by reviewing all event reports submitted the prior day. He must manually review each case in the system and assign a severity code to demonstrate the outcome. He then manually tracks cases that are high risk, so he can investigate them in greater detail later. Rick then reviews security reports from the prior day to determine if there are any high-risk incidents with patients or visitors noted. This takes nearly an hour, but Rick has a few minutes before his first meeting to review emails that might have come in overnight or this morning before he rushes off to his first meeting. On his way to work, Rick listens to an audio file. This isn't a podcast, though. It's a summary of all files submitted the previous day. Rick uses this to get a sense of what to look for when he gets in. It also gives him a sense of how many reports were submitted the prior day. Rick arrives at his office and logs into the event reporting system. Using AI, high-risk cases are flagged. He then reviews a report that lists all high-risk events and provides a reason for the flag. He already knows what he is looking for. A summary of all files submitted the previous day, and the assigned severity code is available for him to review as he chooses. Rick has learned to trust this coding. After all, he taught it himself over the past 2 years as it followed every review in that time to teach it how to look at and assess the information. He also knows the AI has access to the medical record to review the information put in the report for accuracy. Of course, Rick does double-check, but he finds it most reliable. In fact, he appreciates when training it he often found the AI determined code more appropriate in hindsight for items his coding differed. Rick then looks up at the dashboard of important metrics he has on the wall. Today he notices that patient behavior events are trending up. An interactive touchscreen helps review the data. These events have been trending up over the past few weeks. Rick is curious as to what is occurring. He asks the AI assistant to analyze this trend and provide an analysis of potential causes for the increase. The AI assistant scours event reports, patient records, security reports, external crime data, and a host of other data and provides him with an analysis. He makes a few notes on items he would like to explore further to test the validity of some ideas he has based on the data. Rick has several metrics he watches on this dashboard. He has found it has given him insights into items in real time that he simply would never have had the time to explore in the past. Rick then asks his email AI assistant to summarize his current emails and categorize them as urgent, medium, or low priority. He asks the assistant to remind him at 1 p.m. to respond to any of the medium or low priority items that he has not yet gotten to. Rick logs onto his first meeting, a daily team briefing, in the nick of time. When it is his turn to report out, he states that he had not had time to indicate on the huddle board that he has cases to escalate. His next meeting is at the hospital-level safety huddle. It starts a bit late because the administrative assistant got distracted and hadn't copied the board from the previous day to a new spreadsheet. The huddle is interrupted on occasion with various leaders stopping to indicate they have not had a chance to update their responsible items on the board. They ask for someone to help them do so in real time. Rick can't help but think these huddles would end 15 minutes earlier if there weren't so many interruptions. Rick was able to get a quick bite to each before logging in for the daily safety huddle. The interactive board is marked red with incidents to share. An AI tool tied to an automated flow lists the incident number with a short description to prompt him to speak to it when it is his turn to report out. Rick did not enter in any of his data. Instead, they were automatically entered based on the earlier flags present when reviewing the previous day's incident reports. At the hospital huddle, they start on time. Though it is nothing more than a formatted spreadsheet, the huddle board has pre-populated for every leader area along with his. Good conversation is had about some concerns of high volumes. The social work team notes that while there is a high volume of patients, their AI tool has identified several patients that can be considered ready for discharge. The team comments that 5 years ago, we had to scramble to get this data. Now we actually get time to talk with our patients and problem solve. Their celebration is warranted, as the health system has seen a decrease in discharge delays and an increase in satisfaction. Rick must connect with a few leaders to follow up on some events to get some more details right after huddle. He connects with a unit leader and asks that he review an event and mark down her review in the corresponding event file in the system. It seems no matter how much Rick insists follow-up is added in the file, they email him instead. He laments the copy-paste-repeat process. Rick has time to grab a coffee quickly before coming back to his phone ringing. He sees that he had missed 2 calls from the leader over the past 10 minutes while he had been gone. A leader on one of the units has an urgent issue and needs guidance. Rick asks for the medical records number and looks the patient up. He cannot find any documentation related to this issue. Rick struggles to point the leader to the right policy, and a lot of time is spent going over the background of this patient. Rick can't help but be frustrated as a majority of what he is being told is irrelevant to the situation. Still, Rick eventually provides satisfactory guidance. Like clockwork, his phone rings. He recognizes the number from a provider who calls him often with fairly basic questions, but always seems to make the conversation 20 minutes longer than needed. He picks up the phone, hoping this time is different, but it wasn't. Rick follows up with a leader on an event that he needs more details from. The case does not pose an immediate safety risk, but he really hopes to gather learnings from it. The leader promises to look at it. He asks him to enter his findings into the system. Rick goes and grabs a coffee quick. He quickly forgets all about the case, as two separate leaders had stopped him in the hall, starting the conversation with Rick. "Did you hear about that crazy case in the ED?" 2 days later, Rick will need to review the leader's follow-up for the weekly high-risk case review meeting with the quality department. Rick pulls up the file and reads the notes. The leader he had asked to review the case had emailed their response to him instead of adding a note in the system as he had asked. However, the note still showed in the system. Rick had utilized an automated flow into his email which identified cases where requested follow-up was being provided, identifies the appropriate file, and attaches the content to a note in the file, where it should have been entered in the first place. Because of this, he no longer must feverishly scroll through 2 days' worth of emails, hoping that follow-up would catch his eye. When Rick gets back from getting his coffee, he gets a notice indicating, "Risk Consult AI used." He opens the notification and follows the log of an AI agent conversation. A newer leader on a medical floor needed guidance for a patient who was confused but trying to leave. He follows the conversation. It shows the leader entered in the scenario along with the patient's MRN. Based on the input, the AI agent suggested an appropriate course of action. Rick could see the leader was concerned with this answer by the following questions from the leader. The AI agent responds to evaluating internal policy with relevant statutes that have been pre-approved by legal. The guidance given in this case helped prevent a confused and frightened patient from having to be sedated. Every time the AI agent is utilized, Rick reviews the transcript. The error rate is low and never seems to be on critical issues. He knows the agent will place a call to Rick's cell phone automatically when it is unable to provide guidance with confidence, or if the leader appears uncertain about the guidance given. Rick has a trust but verify approach with the AI agent. He worked hard to train it on organizational policies and countless scenarios, both real and created for over 2 years before going live a year ago. Staff were extremely hesitant at first, but found that in certain situations that could be largely managed by reviewing policies, it was a quick reference that could guide them. They were comforted by knowing the guidance was always reviewed afterwards to assure accuracy, and Rick would call them if he needed to provide clarity. Rick was especially curious about this most recent consult. Only a week ago did they go live with an enhancement that tied the agent to the medical record, giving the added benefit of being able to apply patient information to the scenario. He then gets another alert. A provider who used to contact him by phone almost daily had used the AI agent to answer a question. The provider sends him a message later noting they were happy with the quick answer they got from the tool and didn't have to derail their schedule to make the call to him they would have in the past. Rick notes this provider has actually become the biggest champion of this tool, which is a far cry from their response when it was first introduced. In the past, they would have kept him on the phone for 20 minutes to answer a 1-minute question, notified by the quality team that they have found a major issue that impacts many patients. This led to several missing important follow-up on incidental findings from imaging examinations performed during hospital visits for various patients. The team decides they need to triage what patients are high risk, medium risk, and low risk so they can prioritize their follow-up. The team comes up with their criteria relatively quickly. They then divide the task of reviewing the 650 records one by one to determine the risk levels. Cases are divided between 4 people. The team asks if we can come back in 2 days and go over the results. He spends the next 30 minutes going through charts. He makes it through about 5 by the time noon hits. Rick learns of a major concern regarding follow-up on incidental findings. It appears there are more than 650 patients who may not have had incidental findings relayed to them for follow-up over the past few years. The team will need to triage this quickly. Once the triage criteria are created and agreed upon, Rick gets a spreadsheet of medical records numbers. He opens an AI agent that he uses to triage large amounts of patient data. He provides instructions through a prompt to the tool to look for charts and review them based on the criteria given. He attaches a spreadsheet of medical records to the tool and asks it to review each case and add an initial priority to each case with a short description of why it selected the case as high risk. He hits enter and decides it is lunchtime. He lets the tool go to work while he heads off to grab a quick bite to eat. Rick is unsure where he is going to find the time to go through 165 charts. He trudges through about 10 more before he can no longer focus. It is 12:30 and Rick is hungry for lunch. But he has a lot of emails to catch up on. He opens his email while he eats his lunch. Many are spam or awareness-only communications. A few are emails he was added to that have seemingly endless strings to them. He does not find any urgent issues, but several that will need follow-up and input. For now, he must put these aside and try to come back to them later. Rick gets back from lunch at about 12:20. It was nice to catch up quickly and unexpectedly with a colleague from the system office who was there to meet with a leader about a different project. He sits down and feels refreshed. He does need to follow up on a few communications though. His email tool mentioned earlier has found a few emails that are not urgent but do need Rick's attention. He thinks to himself, boy, these are long email strings. He hits a button within the email which states Summarize. A year ago, Rick also created an add-on component to the Summarize function. He has trained that to identify items that he may need to weigh in on or provide input for. Over the year, Rick has become more confident in the output of this as it has also learned how Rick thinks over time. It is true that Rick needs to do some light research on both issues, but despite the long email strings, the input needed from Rick is narrow. By 12:50, he has been able to confidently weigh in on these items for the team. He notes the assessment from the incidental findings issue has identified about 30 cases out of 165 that should be reviewed closely. Out of that, only 2 were flagged at the highest risk level. A majority of the rest had already follow-up that was found by the AI tool. It turns out, most cases were a matter of poor or improper documentation. Rick has set aside some time to get the spreadsheet updated for the upcoming high-risk case review meeting that occurs every week with several key nursing and provider leaders. He wishes they could all work within the reporting system to review cases. He knows incident reporting software has very rigid criteria and parameters for user rights and allocation, which are not able to be customized very easily. He is aware the vendor may be willing to build what they need, but for quite a fee. With the financial struggles the health system is in, it just can't be justified right now. For now, he has to do this manually by copy the leader reviews, them in the spreadsheet, email the quality the system is updated. He realizes he probably needs to better understand the cases. He doesn't want to seem unprepared at tomorrow's case reviews. He takes a deep breath and sighs when he opens the first one and notes the patient's current stay is over a month long. He thinks to himself, scouring over a month's worth of notes eats into the day. At 1:30, he is interrupted though by a frantic call from a leader who states a visitor is out of control, filming everyone and threatening to sue. Rick responds to see if he can calm the situation down, but quickly realizes he is only another person who will take the brunt of it. He can barely get a word in as a phone is hovering close to his face. The visitor is unable to be calmed down and is asked to leave. They do so, but with some resistance requiring security to physical redirect them towards the elevator multiple times. He wonders to himself what social media platform of choice he will be featured on as he walks back to his office. Rick opens a custom platform specially designed for the high-risk case review process. Frustrated with the limited ability to fully engage the team directly within the incident reporting system, Rick utilized several tools native to his organization's base software to create a customized system to manage and review these cases. This integrated several tools to provide key functionalities simply not available in the rigid event reporting software. Rick was able to map appropriate fields directly from an interface created directly to and from the incident reporting system. Now, all data is updated from that system, so all notes and follow-up that leaders have done up to that point are available for review by the team without waiting for the information to be added to a spreadsheet manually. The team especially loves the chat function built in. Best of all, he used tools already available to him, and it costs nothing to create or use. Rick can review and reconcile the most up-to-date information from the file. There are 6 cases in total for tomorrow's review, and Rick feels he has a good handle and understanding of 4 of them. He spends the next 20 to 30 minutes carefully focusing on 2 cases. These cases will likely be marked as serious safety events, which will need to be communicated to appropriate leaders for awareness. Rick used to hate writing these, so he trained a RAG model to draft these trained on his own previous communications. Now, when Rick completes a case, the incident report file is updated and a draft communication is placed in his draft folder, ready to review and send. Suddenly, he gets an urgent alert for a visitor issue on one of the units. For the past decade, it seems patient and visitor tempers have gotten shorter, and Rick finds himself dealing with a lot of upset people. Rick goes up to the unit and is immediately greeted by a phone recording him. The visitor states, "This is being live streamed right now." Rick figured this might happen as it has become commonplace. Thankfully, before he left, Rick grabbed a device about the size of a post-it note and clipped at his shirt. Upon seeing the phone recording him, Rick turns on the device. It emits a humming noise which is barely audible. A small camera in the device identifies the camera of the phone and projects an LED light at it. The device was trained on object detection extensively, so it can follow the camera of the phone to direct the light narrowly at the camera. Rick learned about 2 years ago that while the noise is barely audible to the human ear, the specific frequency is used to distort the phone mic to the point where the audio cannot be distinguished. He also learned the light frequency is designed to essentially wash out the picture. The visitor is eventually escorted out by security. As Rick walks back to his office, he can't help but think how many viral moments this device has saved him from. Rick must call an upset patient about a concern. He spends about 20 minutes listening as professionally as he can, despite the rude and vulgar tone of the patient. As he had feared, he needed to end the call because it was not productive. The patient was not happy. Rick is late for his meeting on an important project. Rick is nervous. He may miss something. He hops on and says, "Sorry, I'm late, everyone." The meeting stops so the team can catch Rick up on the conversation. Rick is quite embarrassed. No one has outwardly given him a hard time, but he wonders if he is viewed as disorganized. Rick logs into his 2 p.m. meeting late because he had just got an angry call from a previous patient with a complaint who had been routed to him by the operator. The tone of the patient gets increasingly agitated to the point where the patient is yelling. Rick knows nothing good will come out of this. The call is interrupted with an automated message stating, "This call is being terminated due to a violation of our behavior expectations." Rick is relieved. He has heard that before. He is thankful that a year ago his leaders supported an idea from another team member to implement AI technology that will end a call based on identifying sustained verbal aggression. Rick reflects that he is impressed. When it was first introduced, Rick was skeptical. After all, patients can be understandably emotional at times. Is it fair to cut them off just because they lose control briefly? Rick truly prided himself on being an effective problem solver. He was relieved when he realized over time that the system did not cut off a call due to 1 or 2 short outbursts. Always curious about how stuff works, Rick had asked about the tool to the IT support person he knew oversaw this technology. She explained that the system is designed to measure several parameters. It has an algorithm that helps it decide when to end the call. This algorithm was trained by listening to thousands of previous calls. With guidance and direction from the programmer, the AI fine-tuned the algorithm. The IT support person laughs as she reflects, "Yeah, the first attempt was bad. It was marking calls to be cut off when the word gluteal was used. It took us 3 or 4 rounds, but we were able to fine-tune it consistently with what your boss wanted." She comments, "I bet people are really shocked when it happens." Rick agrees they probably are, but notes they shouldn't be. They are given a warning that aggressive behavior will not be tolerated and calls will be terminated before they even talk to Rick. But for now, back to the meeting. Rick can tell the team is in the middle of a topic that he has been a bit nervous about. Rick asks his AI assistant to summarize the meetings so far. He is provided with a quick summary of the discussion. Rick is relieved when he notes that the concern he had was addressed appropriately before he was able to log on. Rick goes back to trying to fit in some work on a risk assessment he was doing. He has a risk heat map he is working on which he hopes will demonstrate the risk level of a planned service edition. He is struggling with getting the plots to show correctly. In the middle of his struggle, his boss calls. He sighs as he knows he is about to lose his train of thought, but knows his boss generally only reaches out unannounced when something important has come up. He answers, and his boss states the patient he had talked to earlier had called to complain about his, and she wants to know what happened on the call. It is obvious to Rick that the patient is attempting to paint him unprofessional and unhelpful. Rick does his best to explain the situation. His boss comments that she can see how the patient might have been difficult. Still, she is puzzled how the patient described Rick's behavior. Rick is working on a risk assessment for a project he is involved in. He notes that all stakeholder areas have updated their input for his most current assessment. He opens his webpage for the assessment, which is nothing more than a collection of apps on one page that are integrated together. Utilizing connectors, RAG models a heat map appears and adjusts as new data comes in. He thinks briefly about how it is kind of like the previous software they had, which was okay but had suddenly closed, leaving them in a bit of a scramble. This new tool was created by an internal team utilizing multiple apps, connectors, RAG models, and AI. It is much more flexible and seems to be better tailored to their needs. Just as Rick returns to his office, he gets a call from his boss. She is furious. "Rick, I got a call from the patient you just talked to. Your behavior is totally unacceptable." Rick pauses in with confusion. Who is she talking about? She states that she wants him to hear for himself how unprofessional he sounded and sends him an audio file for him to listen to. He recognizes the voice of the patient he had just talked to a mere hour earlier. He also recognizes his voice. As he listens curiously, he notes that sure sounds like me, but he doesn't remember saying anything close. He becomes downright shocked when he hears himself make vulgar comments to the patient. "I know I didn't say that," Rick thinks to himself. Flustered, he tries to make sense of it all. Then he remembers a new tool that he recently saw advertised. He logs onto a website who offers a free product that detects the authenticity of any audio, video, or photo. This new technology was in response to escalations over the years of fake media and what is known as deepfakes. He uploads the file. Metadata analyzed demonstrates the audio file had been altered several times. It shows a specific software was utilized to capture his voice and interject statements typed by the patient into a prompt. The software then put that statement in his own voice, complete with his own tone and style. He reflects how convincing it was. After all, it captured his own tendencies in speech almost to a T. No wonder his boss was upset. Armed with the metadata analysis, he emails his boss and attaches the report. The report found embedded metadata that contained the original source audio, the software used to alter it, and even what statements were created by the software in an almost transcript-like format. Rick was relieved to prove to his boss that he did not lose his cool. Rick is exhausted. He notices on his calendar. He needs to do a walkthrough with the facilities team on a new mental health area under construction. He needs to assess various elements of the design for potential risks to a behavioral health population. Rick is a bit nervous. He knows the stakes are high for this, and the regulations are stringent. Though Rick has a decent handle on these, he has always relied on the regulatory specialist to be by his side during these assessments. Unfortunately, today the regulatory specialist can't make it. He had asked Rick to take some notes for him and expressed the utmost confidence in Rick's ability to have a keen, sharp eye out for all issues. Rick spends the next hour touring the area, making some notes on a scratch pad. The tour is over right at 5 p.m., but Rick sticks around and does at least 2 more walkthroughs. Deciphering all this tomorrow is going to be a long day, he thinks, as he notes he already can't fully read some notes he made a mere 30 minutes ago. Rick takes a second to gather himself after that interesting situation with the patient complaint. He then gets ready for the tour of the new mental health area, for which he needs to assist with a risk assessment. He got an email earlier today from the regulatory specialist. He is sick today and is hoping Rick can take some notes for him. No problem, Rick thinks to himself. After all, they both use the same tool anyways. Rick pulls off a base charger, a peculiar-looking device. It almost looks like a monocle or something attached to a pair of glasses. He catches a glimpse of himself in the window on the way up to the unit. He can't help but notice he kind of looks like a cyborg or something. He laughs to himself and thinks, maybe I'll just put this on when I get up there. When Rick gets to the unit, he walks around with the team. He jots down a few notes, but honestly not many. The team has some discussion about some of the basic considerations for the project. The peculiar device is recording the entire tour exactly as Rick sees it. He sees a few red squares pop up from time to time in the device. It seems to be outlining certain items. This is a bit distracting and annoying. It even gives Rick a headache if he uses it too long. He knows that it is worth the trade-off though compared to how he used to do these assessments. He is more than happy to deal with it for the bulk of the 45-minute tour. It is the end of the day, and Rick needs to go pick up his 4-year-old from daycare. He throws his notebook down on his desk that contains the sloppy notes he took from the tour, wondering to himself if he is going to be able to provide the value that the team seems to trust he will. Rick makes a post-it note for things he probably should follow up with as soon as he can. Rick knows he should probably bring his computer home tonight, but it is his 10-year-old daughter's state gymnastics meet tonight, and he knows he will not have any time. He walks out of his office at 5:40 p.m. and rushes off to pick up his daughter from daycare, so he doesn't get yet another late fee. Rick got back to his office immediately after the tour, around 1700. He plugs in his video adapter tool. Once he does this, the video will upload into the detection and assessment software. Rick knows it takes a while to download this, but he isn't worried. He knows that as soon as the data is downloaded, the file will be analyzed, and he will have a templated report in the morning. It will likely point out items that he had picked up on during the walkthrough, and more that he didn't than he would like to admit. He knows he should spot-check a few things and may have to make some minor corrections, but the report has changed Rick's fear of not even knowing where to begin immensely when he was previously required to write reports from scratch with nothing but a loose template. He also looks forward to discussing the next steps for following up on the incidental findings issue for the 30 patients who may be at higher risk, identified earlier in the day. A report was sent automatically to the team earlier today, so they will be fully prepared to discuss the next steps. On the original meeting, it was marked and designated as a high-priority safety concern requiring follow-up as quickly as possible. Because of this, he knows a meeting will be scheduled tomorrow at the soonest time everyone is available. He no longer must think back and wonder, was I supposed to schedule that? Rick has his daughter's state gymnastics meet to go to tonight. He is excited to see how well she does. He leaves work knowing there is always more that can be done but is satisfied where he left things for the day. Thank you for listening to Rick's story.